Welcome to the European Parliamentary Research Service podcast on organ donation and transplantation.
Organ donation and transplantation saves lives, thousands of lives. And while some countries have seen encouraging increases in donation rates, in others, transplantation rates have been stagnating or even decreasing.
Responsibility for health policies lies primarily within member states, but how can the EU bolster cooperation to save even more lives? Stay with us.
We've come a long way since the first successful kidney transplant in the United States in the 1950s. Nowadays, organ transplantation is an established worldwide practice and one of the 20th century's top medical advances.
Demand for organ transplantation is increasing, but a shortage of donors means there's a lack of available organs to meet the need, which results in long waiting lists for patients.
Indeed, in 2018, more than 150,000 EU citizens were on organ waiting lists, 7% more than in 2014. And an average of 16 patients die every day while waiting for the organs they need, mainly kidneys, livers, hearts and lungs. So why aren't there more donors?
Well, that's a difficult question to answer. There are several explanations. First, we need to understand that there are different types of donations. So nowadays in Europe, the main source of transplantable organs is donations from deceased donors, especially following brain death.
Deceased donation is a source for kidney, liver, heart, lung, pancreas and small bowel transplants, while living donation is mainly performed for kidney transplants and some liver transplants.
Another important factor is that organ donation rates for both deceased and living donation vary widely across the EU. In 2018, for example, the number of actual deceased donors ranged from 48 per million people in Spain or Croatia to not even one person per million in Romania.
And living organ donation practices vary too. That's partly because member states have different systems in place to seek people's consent to donate their organs after death. In the opt-in system, used by countries such as Germany, Denmark, Lithuania or the Netherlands, consent has to be given explicitly, while in the opt-out system, used by Belgium, Croatia, Spain, Poland or France, you are considered a donor unless you explicitly ask not to donate.
10 years ago, the majority of EU citizens supported organ donation, with 55% expressing the willingness to donate their own organs after death and 53% willing to consent to donate organs of deceased close family members.
According to a Eurobarometer survey, distrust of the system and fear of manipulation of the human body were the main reasons for people not wanting to donate their own organs.
It's clear that when we talk about organ donation and transplantation, we need to take into account a broad range of medical, legal, religious, cultural and ethical considerations. So what role can the EU play here? Stay with us.
Well, although the main responsibility for shaping health policies lies primarily with the EU member states, the EU has addressed the issue of organ donation and transplantation through legislation, an action plan and co-funded projects.
And let's not forget that the European Parliament has also adopted own initiative resolutions on various aspects of organ donation and transplantation, for instance, to ensure that organ donation remains voluntary and unpaid, or to protect anonymity, traceability and transparency of donation procedures.
EU laws ensure that transplants are carried out in a manner that shows respect for fundamental rights and for the human body. To prevent organ trafficking and transplant tourism, the EU also applies the principles and good practices set out by World Health Organization.
EU rules also ensure the quality and safety of organs intended for transplantation, and through its action plan on organ donation and transplantation, the EU is also trying to increase organ availability, improve the efficiency and accessibility of transplants, and invite EU countries to cooperate more with each other.
And the plan is bearing fruit. A study on its impact showed that, with a few exceptions, donation rates in the EU went up substantially, resulting in more transplant operations and lives saved. Also, thanks to organ exchange platforms set up with EU support, the cross-border exchange of organs has helped to optimise the use of available organs.
But demand continues to outstrip supply in all EU countries, with thousands still waiting for organs. That's why, for the current Croatian presidency of the EU, increasing organ donation must remain a high priority for the EU, for member state governments and for all citizens.
So what does the future hold for organ donation and transplantation? Stay with us.
Well, there may be reasons for cautious optimism. First of all, a number of stakeholders from the organ donation and transplantation community have shared their joint vision for improving organ donation and transplantation in the EU. Secondly, an evaluation of the EU's action plan identified the need for a new, improved approach to cover areas such as communication, education professionals, end-of-life care and research.
And we also need to think about technology and innovation. If we can use artificially grown organs and 3D bioprinting, who will need donors in the future? This may be pushing things too far, but it is a scenario worth considering, and one which raises new ethical issues.
For instance, who would have access to those organs, and how would hospitals allocate them? Would they be free, or would patients need to pay for them? Also, there may be waiting lists for printed organs due to limited production capacity and high costs.
There are certainly issues to consider, but before bioprinting solid organs becomes standard medical practice, there is a lot we can all do to improve organ availability and save lives.
You're listening to the European Parliamentary Research Service podcasts.